Hi guys, and welcome to finally the last part of the brainstem, which is the midbrain. Okay, so now this is the external features. So when we talk about the midbrain and we say that we have external features and we look at the brain from the anterior side, you guys, the only thing you can see is what we call the cerebral peduncles. Okay, so the cerebral peduncle is kind of a stalk-like. It's kind of something that your brain, something that you are holding your brain on. These are the cerebral peduncles. They are very important. We're going to talk about them now. So the only thing I can see from the midbrain here is the cerebral peduncles, and this is what we call the interpeduncular fossa. I'm not going to talk about this. So this is the cerebral peduncle. So what else you can see here? And remember, guys, I told you everything anteriorly is motor. Remember, the transverse pontine fibers were here, the corticospinal corticonuclear tracts were here, the pyramids were here, and now we're gonna talk about also corticonuclear fibers and corticospinal fibers descending in the cerebral peduncles. Okay, so everything here is motor, and also cranial nerves. The cranial nerves, we can see them as the oculomotor 3 is related to the midbrain, and the winding trochlear is also having their nuclei in the midbrain. This is what we can see from the ventral aspect. What we can see from the dorsal aspect, you guys, this is the midbrain. So in the midbrain, we have something called corpora quadrigemina. Corpora means, corpus means body. Quadrigemina means I have 4 bodies, 2 superiorly and 2 inferiorly. The superior ones, guys, are related to your eyes. These are your visual reflex center, and this is anything related to your eyes is going to be going to your eyes. Okay, the superior colliculus. When we say tactile, it means the superior colliculus. This is the superior colliculus. This is your eyes. Okay, the superior colliculi. And down here, the inferior, it's related to your ear. It's related to your ear. Remember, you guys, when I told you previously and I talked about the auditory pathway, and I told you that we are receiving the information from the inner ear by the cochlear nerve, and then they will stop in the cochlear nuclei, and then they will cross forming the lateral lemniscus, and then they will do the trapezoid body, and then they will reach the inferior colliculus. Remember, when they reach the inferior colliculus, they need to reach by that to the thalamus, because after the thalamus, we will reach the cerebral cortex. Inferior colliculus is going to be connected by inferior brachium. Okay, the brachium means arm. This is the arm that will connect my colliculus to the thalamus. Okay, to the this is the thalamus. Okay, now, because afterwards you will take the nuclei in the thalamus. You will hear about something called lateral geniculate body and medial geniculate body in the thalamus. Okay, so the information from the inferior colliculus, it will go through the inferior brachium. This is the lower arm, to the thalamus. Which geniculate body? The geniculate bodies are related to the superior and inferior colliculus. Okay, M is for music. So hearing information is going to go to the medial geniculate body. L is for light, not all. L is for light. So the information about the eye from the superior colliculus is going to go through the superior brachium to the lateral geniculate body. And from here, it's going to go to the visual center in the cortex. And from there, it's going to go to the auditory center. Okay, guys? So this is just to continue our talk about the and to understand also what do these corpora quadrigemina do. Okay, so this is basically your tectum. Okay, the colliculi is basically your tectum, and then the tegmentum is going to be on the other side. What else? Okay, so here you have the superior colliculi, you have the inferior colliculi, you know the function of them, and you know how they are connected to the thalamus to get the information from the eye all the way to the cerebral cortex through the thalamus, and to take the information from the hearing from the inferior colliculus through the inferior brachium to the medial geniculate body of thalamus, and from there to the auditory center. Okay, so what we have today, what we have now, it's all about the level of the superior colliculus and inferior colliculus. Okay? Now, in the level of the, and you guys know that we are going down to up. Okay. Now, remember that previously when we talked about the pons, we said that if we are behind the, if we are at that region, we are about the superior cerebellar peduncles and stuff related to the cerebellum. And this region is tegmentum. And that region is motor stuff. Here we have the same idea, but we have here extra thing which is behind or beyond the CSF ventricles. We have the tectum, okay? And the tectum here is the inferior colliculus. Okay, if you are at the lower level, which cranial nerve nuclei do you think you will find in your tectum? It's number 4, because we are moving in order, right? In the superior, I have here superior colliculus, I have inferior colliculus. Here, this is the level of 3rd cranial nerve. Here, this is the level of 4th cranial nerve. Okay, so this is the inferior colliculi. Okay, this is the bulging of the inferior colliculus related to your ear, of course, information to the ear. All right, and this is the cerebral aqueduct. All right, and then this is the nucleus of your 4th cranial nerve. It's gonna wind around and it will exit from the ventral surface of your cortex. Remember, I told you that? And the ventral surface, remember, guys, the only thing we could see from the ventral is actually my cerebral peduncles. So the cerebral peduncle is having the tegmentum, my core, that has the lemnisci and cranial nerve nuclei, okay? And it has something called the cross cerebri that has the motor stuff descending. We have something called corticopontine, frontopontine. It's all about axons coming from the cortex, motor axons coming from the cortex to here. The most important thing you need to know is the corticospinal and corticonuclear fibers. Okay, don't worry about that, the temporopontine and frontopontine fibers. They are all coming to the pontine nuclei and then they will go to the cerebellum. Okay? So now we have, this is the inferior colliculus level. This is the tectum part. Okay, the inferior colliculus. This is the level of the 4th cranial nerve. And here I have the, don't forget the medial longitudinal fasciculus. And then remember your lemnisci in the tegmentum. I have cranial nerve nuclei, which is trochlear nerve, number 4, because this is lower level 4. And I have the lemnisci. The lemnisci that are very prominent that I can see is medial lemniscus and lateral lemniscus. You can also see trigeminal and also spinal, but you guys, to be honest, the most lemnisci we can see in brainstem are the medial lemniscus and lateral lemniscus in the lamellated sections that we will see in the coming slide. Okay, so mostly in exams they ask about medial and lateral lemniscus because trigeminal is not easily seen and spinal is not also easily seen. Okay, and okay, so what else? Here we have the mesencephalic nucleus of trigeminal. That's fine. And what do we have here? We have the decussation of superior cerebellar peduncle. Okay, so here we have decussation of superior cerebellar peduncle. So guys, in the midbrain we have 2 levels, the inferior colliculus level and superior colliculus level, and both of them they have decussation. In the inferior colliculus you have the decussation of superior cerebellar peduncle, very prominent here. In the superior colliculus level you have the decussation of someone else, and I will tell you now who's that. Okay, and between the tegmentum, guys, and the crus we have something called substantia nigra, and that we're going to talk about it in the basal nuclei, and we will see that they are secreting the dopaminergic neurotransmitters, and they have very important function in basal nuclei. Okay, so in the cerebral peduncle you have tegmentum separated from the crus that have the motor descending fibers by substantia nigra. Okay, so this is the cerebral peduncles, the stalk that gets into the cerebral cortex. Okay, and this is the tectum, which is the inferior colliculus. Great. Let's look at this picture. How can I know in the exam that this is midbrain? Because you guys, you have the cerebral peduncles. This is the only cross section that you can see cerebral peduncles. It's one peduncle and one peduncle. This is where you have the descending corticospinal corticonuclear fibers. Remember, you guys, can you guys see these two? these two, if I take a cross section here, I will have this. Okay, so this thing, I can only see them in the midbrain. This is motor stuff, and this is the substantia nigra that separates your motor stuff from tegmentum. And in tegmentum, if you can see something black, it means fibers. If you can see something fibers. If you can see something white, it means nuclei. And don't forget your medial longitudinal fasciculus. Okay, so remember I told you the lemnisci that we can see are the medial lemniscus and lateral lemniscus. All right. And we have, yes, this decussation. And how can I know that which decussation is this? I'm telling you now. If you are in the midbrain, if you can see the cerebral peduncles, you are in midbrain, and you have colliculi midbrain. If I can see only colliculi without red nucleus, this is inferior colliculus. What was the question? Yeah. What kind of crossing you will find? It's the crossing of the superior cerebellar peduncle. Okay, what else do we have? We have the other level, which is the superior colliculus level. How can I know it in the exam? From the cerebral peduncles. And I have colliculi. Cerebral peduncles means midbrain. Colliculi means midbrain. If I can see extra eyes here, and this is the eyes level, the superior colliculus, you know, it's the visual center. So red nucleus is at the level of superior colliculus. So in the exam, if you see cerebral peduncles, this is midbrain. If you see extra eye here, this is the eye level, superior colliculus level. Which cranial nerve here? Number 3, the oculomotor nerve. All right. What do we have in the tegmentum? The lemnisci and cranial nerve nuclei. We have also red nucleus, and the decussation, we call it what? The decussation of rubrospinal tracts, because red means rubro, okay, in Latin. Okay, so what do we have here? The descending corticospinal or corticonuclear fibers, and the substantia nigra separates your crus from the tegmentum, and the whole thing we call it cerebral peduncle. So cerebral peduncle, it has tegmentum, substantia nigra, and crus that has the motor stuff. And here, lemnisci, cranial nerve nuclei. There, tegmentum, superior colliculus level. How did I know? From the red nucleus. What kind of lemnisci? Medial and lateral lemniscus, the most prominent ones. If I have this in the exam, I can know it because here I have the cerebral peduncles. This is the crus that has the corticospinal and corticonuclear fibers. The white thing is the substantia nigra. The core is my tegmentum. I have extra eyes, so this is a superior colliculus level. This is red nucleus, and this is the decussation of rubrospinal tracts. If I have something black in the tegmentum, medially, medial lemniscus. Laterally, lateral lemniscus. The most medial longitudinal fibers, the medial longitudinal fasciculus. Okay, guys? Perfect. Now, what are the cranial nerves related to the midbrain? It's your 3 and 4 cranial nerves. And also remember the nosy trigeminal was giving us the mesencephalic nucleus here. Okay, so what does the oculomotor nerve do? It supplies all the muscles of the eye, oculomotor, normal oculomotor, except SO4 and LR6. What will happen if I have an injury to the oculomotor nerve? The lateral rectus muscle is gonna be dominant. So SO4, forget about it. It's not gonna be dominating in anything, and you will know in the eye videos why. But think about lateral rectus, because it's the only muscle that causes abduction to the eye. So if I have a problem to oculomotor, I'm gonna have abduction because LR6 is gonna be dominant. It's gonna take the eye all the way to its side. Okay. Now, what about the what another thing can happen if I have oculomotor nerve injury is that the oculomotor, it has something called Edinger-Westphal nucleus. It gives the parasympathetic innervation to the pupil and ciliary muscle, and so the parasympathetic is actually innervation to the pupil and ciliary muscle to cause dilation to the pupil and the ciliaris muscles. It affects both the pupil itself, and it affects also the ciliary muscles that control the eye. Okay, this is the function of the oculomotor nerve. So the trochlear nerve supplies the superior oblique. If I have an injury to the trochlear nerve, this is what's gonna happen. And all these lesions are explained in the eye videos. Okay? Okay, so now we are reaching the blood supply of the midbrain. And like I said previously, guys, I told you that the blood supply of the midbrain is by the superior cerebellar artery and the posterior cerebral artery. Okay? And I explained to you why. Because vertebral and pica supplies the medulla, and then the basilar and the ica supplies the pons, and the midbrain, posterior cerebral and superior cerebellar. Okay? What will happen if we have midbrain lesions? Remember our golden phrase, guys? Our golden phrase, the alternating something hemiplegia. Remember that was applied for the medulla. We had alternating hypoglossal hemiplegia. In the Millard-Goebler syndrome, we had the alternating abducent and facial hemiplegia. And now the prominent cranial nerve is the oculomotor. So we call it Whipper's syndrome. This is what will cause you alternating oculomotor hemiplegia. How can you remember that? Whipper, it's a whip that the spider does when it moves. So it needs motor. So it's related to the motor fibers that we have. Okay, so if I have the Whipper syndrome, we will have a problem to the oculomotor here, the oculomotor nerve, and it's gonna also affect number one, this one, the orange, this is number one. In Whipper syndrome, we will have problem with the descending corticospinal fibers. Remember, this is the crus, guys, crus cerebri of the midbrain. So we will have a problem here. It will also affect the oculomotor. So what will we have? We will have contralateral hemiplegia of the body. So remember, this is the face, our famous body. If I have a problem in this side, I will have contralateral hemiplegia and ipsilateral oculomotor problem. If we are in the medulla, ipsilateral hypoglossal nerve injury. If we are in the pons, ipsilateral abducent and facial nerve problem. If we are in the midbrain, the Whipper syndrome, it's the one that is related to the motor stuff. So we will have motor loss, contralateral hemiplegia, and ipsilateral oculomotor hemiplegia, oculomotor nerve injury. And you know by now what will happen if we have oculomotor nerve injury. We will have paralysis of all eye muscles except LRX6 and SO4, and we will have loss of parasympathetic innervation to the eye. And the other syndrome, it's the Benedict syndrome. And because I like Egg Benedict, so this is how you remember it. If you like Egg Benedict like I do, and you will have a problem, you cannot resist that the Egg Benedict is so nice, so that you will get hemiataxia, and you will have problems with the red nucleus, and you will have sensory loss. Everything is gonna affect your feelings because you saw the Egg Benedict that I like, and of course you like it, right? Okay, so the Benedict is basically here. That is gonna affect your oculomotor also. It's going to affect your red nucleus. You'll have a sensory loss because of the medial lemniscus, a proprioceptive sensation. So it's all about your feeling when you see the delicious Egg Benedict that I like. Okay? So this is how you guys can remember the midbrain lesions in your exam by the names of the scientists. Okay, so now we have a very important story, which is the MLF, the medial longitudinal fasciculus. Actually, this is a very important fasciculus that kind of controls and connects between the vestibular nuclei and many things in the brainstem. But the most important thing is actually going to be the vestibulo-ocular reflex. Actually, what's going to happen is the medial longitudinal fasciculus is going to receive fibers from the vestibular nuclei. They are going to receive fibers from the eye muscles, from the nuclei of all eye muscles, and also from lateral lemniscus, and also from other parts of the body. And eventually, once we receive information, we need to make the other eye aware of what this eye is doing. So the idea here is all about a silly big sister. Her name is lateral rectus muscle. The lateral rectus muscle, guys, wants that when she wants to decide to move, the oculomotor of the other side follows her. She's a very silly because she wants to dominate. What's going to happen is if I have a problem with the medial longitudinal fasciculus of the affected side, the connection from the lateral rectus to the other oculomotor is going to be lost. Okay, so basically from the lateral rectus, I need to send information to the other oculomotor and superior oblique by all the connections through what we call the interstitial nucleus of Cajal, or I don't know how you pronounce it. Okay, this is basically communication between the nuclei of the three cranial nerves controlling your eyes. So the big boss is the lateral rectus. Once it decides to do abduction, it will tell the other eye to do adduction at the same time. Okay, now what will happen if I have injury? If I have injury in my MLF, medial longitudinal fasciculus, so let's say I like this diagram that's done by the sketchymedicine.com. It's very nice. So if you have a patient, okay, here the patient is looking straight ahead, all right? If you ask him to write to the right side, this is fine, okay, because my silly big sister is in this case is here, the left lateral rectus, okay? So she doesn't want to move now, so there is no problem if I ask the patient to look at the right side. Now the silly big sister now decided to look at the left. So if your right medial longitudinal fasciculus is injured, it means that the control from this sister is not reaching the oculomotor of the right eye. It means your right eye will fail to follow you. So it will be unable to adduct. It will be unable to follow the left eye. However, if you ask the patient to cross your eyes, he will be able to cross. It's okay. But it's not going to follow its sister. So the young brother, which is here, when the sister tells him, look to the left, it's not going to do that because it has a lesion in the same side. However, if you tell the patient, cross your eyes, it's going to do because this is her decision. It's not a decision of the left eye. Okay, so do you guys understand then the idea of conjugate eye movement? It's when I tell you, look at the left, it means the left lateral rectus wants the right oculomotor nerve to follow her. In this case, she cannot do it because the connection is lost. However, if I tell the patient to cross his eyes, he will do it because the lateral rectus is not sending anything to this eye. So from its own, it's going to do that. And that can also end up causing nystagmus to the abducting eye. All right? So eventually that can cause nystagmus at the abducting eye if you have a problem in the medial longitudinal fasciculus that is controlling the communication between the extraocular, the nuclei of extraocular muscles. All right? Okay, so let's see, guys, if you can envision the whole story of the brainstem. This is you, and you have the medulla, you have the pons, and you have the midbrain. And let's see if you guys can remember that. Okay, so I have here a recap about the brainstem before I ask you to envision. Okay, fine. Let's get back. We will get back to this. This is just a very nice diagram that shows you guys, like I said, that the cranial nerve number 3 and 4. 3 is related to the superior colliculus. This is just a recap. 4 related to the inferior colliculus. They are in midbrain. And then in the pons, we have 5, 6, 7, and 8. All right, so we have 5, 6, 7, and 8 here in the pons, and then we have 9, 10, 11, 12 in the medulla. So if you look at the midbrain cross sections, you can see the cranial nerves 3 and 4. This is 3, the red, and this is 4, trochlear. And then here you have the main sensory and motor nuclei and the pons. And here you have the abducent, and the facial is winding around. And this is the last. Remember when we were mature enough to start talking about the cranial nerves, it was at the butterfly level of the medulla. This is the last cranial nerves related to your brainstem. Let's see if you have a question in the exam. Let's see if you guys can recall. These are all the sections, and I'm sure everyone will be able to tell everything about this. Let's choose one and see if you can remember. I will answer on behalf of you, but I'm sure that you guys know. Let's say that you have this in the exam. Okay, so I can see that this is medulla. How did you know? Because we have the bumps, we have the nuclei, where we have the stopping of the dorsal columns. So we have the cuneate nucleus, we have the gracile nucleus, cuneate nucleus, spinal nucleus, and this is the level of sensory decussation. Oh, I know it. This is the medulla at sensory decussation level. Perfect. What about this? This is the bird that's sitting on the pyramid. This is the level of pyramidal decussation. Wow, great. What about this? This is the butterfly that is holding the olive. So this is the olive level. And this is the inferior cerebellar peduncle. This is medulla. And this is, I'm mature enough to talk about the cranial nerves. I have the hypoglossal, I have 12, and I have 10, and I have 8, and I have the triangle that has the medial lemniscus. I have the tectospinal, and I have the MLF up here. Perfect. And this is the inferior olivary nucleus. This is the pyramid, and this is the olive. Great. What about the seal? What is that? This is the story of the transverse pontine fiber. So this is a pons. Oh, great. So what about that? This is a superior cerebellar peduncle, because this is breaching the cerebellum. And if I have something deep here, this is medial lemniscus, and this is lateral lemniscus. This is my tegmentum part. This is the story of the transverse pontine fibers, the pontine white nuclei, and the bundles of corticospinal corticonuclear fibers. Oh, great. What about this? Oh, here I can see the cerebral peduncles. Can you guys see the cerebral peduncles? And I can see extra eyes. It means this is my midbrain at the superior colliculus level, and this is the red nucleus, and this is the cross-section of rubrospinal tracts, and this is my tegmentum, and this is the substantia nigra that separates my tegmentum from the crus. And in the crus, I have the descending corticospinal and corticonuclear fibers, because you told us that everything anteriorly is motor. This is motor, this is motor, this is motor, this is pyramids motor, this is pyramids motor, this is pyramids motor, this is the story of the pontine fibers. Okay, so this is also pons. Okay, but this is cerebral peduncles. Okay, and here I cannot see the red nuclei. So this is the inferior colliculus level. So this is a midbrain. Tegmentum is in the center. This is the lower level. It means which nucleus do I have at this level? The inferior. It's the trochlear nerve. So here, oculomotor, number 3. Here is number 4. And then 5, 6, 7, and 8, I have them in pons. Okay. And 9, 10, 11, 12 are here. And we know all the exceptions. And then here, this is a pyramidal decussation, and this is the sensory decussation. And that's all we have, you guys. Thank you guys for watching. With that, we are done with all the brainstem. I hope you guys grasped it very well. I hope it became very easy and a piece of cake. Thank you guys for watching again, and I will see you in the next topics of the neuroanatomy.